Hello, my name is Melissa Gramajo. I'll be a junior at John Marshall High School next year. And this summer, I was a science internship program for nursing participant at Euclid Hospital on the third floor medical surgical department. My project is on hourly rounding compliance as it compares to call light usage. Call light. A call light is a bedside button located on the wall in a patient's room. It is typically found above the headboard of the patient's bed for easy access. Pushing the call light button directs a signal to the nursing station indicating a need requiring attention from the nurse on duty. The call light is a vital communication link where response time is primarily determined by nursing staff's reaction to each call light. All Cleveland Clinic hospitals abide by a no pass zone rule, meaning any employee who notices a call light is on must attend and answer to it. Hourly rounds. Hourly rounding is a system developed by and for nurses to reduce the noise and interruptions caused by unnecessary call lights. Addressing the 4 Ps, pain, position, potty, and possessions, hourly rounding can improve patient satisfaction. Hourly rounds is not a new strategy, and it has been proven by numerous studies that hourly rounding significantly reduces call light use. The 4 Ps. The 4 Ps vital for successful rounding consists of positioning, making sure the patient is comfortable, and accessing the risk of pressure ulcers. Personal needs. Scheduling patient trips to the bathroom to avoid unsafe conditions. Pain. Asking patients to describe their pain level on a scale of 0 to 10. Placement. Making sure the items a patient needs are within easy reach, such as water, tissues, the TV remote control, and the telephone. Afterwards say, "Is there anything else I can do for you before I leave?" Hypothesis. This study sought to determine whether or not hourly rounding system addressing the 4 Ps lowers the amount of call lights in a nursing station. Moreover, does the hourly rounding protocol anticipate the patient needs in order to bring satisfaction in nursing care management? Is the no-pass zone a proactive and productive rule to guarantee a patient's needs are met? Here is an example of an hourly rounding log sheet used by nurses. They're typically found on the bathroom door. And here's a rounding data collection audit tool. Again, they are found on the bathroom door. Methodology. After researching many articles dealing with call lights and hourly rounding through Euclid Hospital's library website, such as the Journal of Clinical Nursing, relationship between call light use and response time, and inpatient falls in acute care settings, my mentor showed me how to answer and use the call light system at the nursing station. Response time to call lights is generated from the tracking system in seconds. By recording the time that would pop up on the call light system touchscreen in the nursing station, I could accurately measure nurse response time. I answered call lights and went into the patient rooms to confirm the signal. If it was something I could lend assistance in, such as getting water or changing the channel, I would happily oblige. Every hour on the hour, I went into each patient room and checked the hourly rounding log sheet to record whether or not the nurse came in to see the patient within that hour. Results. This is a pie chart on the reasons for activating the call light system based on amount of calls. And this is also based on the findings from the effects of nursing rounds on patient call light use, satisfaction, and safety study. So 37% of serious medical concerns made up the amount of calls, 20% secondary medical concerns, 14% non-serious personal health issues, 2% room amenities, and 10% were no reason miscellaneous. And this is another bar graph that shows the top reasons for activating the call light system. And here are the results for the average daily census in hours per patient day in study units during the 1 hour and 2 hour rounding periods. Conclusions. Hourly rounding is an effective protocol that reduces the frequency of call light use significantly. Based on the results from the previous studies as well as observations from my own in Euclid Hospital's third floor med-surg department, addressing the 4 Ps can also limit the amount of calls from patients exponentially. Outcomes showed that patient satisfaction soared with the implementation of hourly rounds. It has even been proven that hourly rounds can reduce call lights by as much as 50%. The no-pass zone received positive feedback in quickly addressing patient needs. My own research coincided quite well with previous studies, including that of effects of nursing rounds on patients' call light use, satisfaction, and safety, and which I compared data with. This procedure has been effective in steadily reducing call lights, which can overall make for a less stressful shift for nurses. Recommendations. Nurses should remember to sign off each hour on the hourly rounding log sheet because even if they did go in to check on the patient, the log sheet says otherwise. Make sure the call light is in an accessible area that is easy to reach but also not close enough that a patient may simply sit on it or accidentally push the button, sounding off the signal. This can take valuable time away from the nurse on duty to answer the call light. Educate newly admitted patients on call lights, making sure the patient understands what pushing that button means. Continue answering call lights as soon as the signal is heard or seen. Acknowledgements. Thanks to the Medical Surgical Department at Euclid Hospital for all the help and insight that was provided to me. A special thanks to Rosalind Strickland, Nedra Starling, Patrick Finnegan, aka Patty, Kathy Tyrell, Christy Ellie, and all the nurse of the third floor.